Laboratory for the respiratory system. Learning objectives for the respiratory system. Be able to distinguish the various regions and subdivisions of the respiratory system and relate the morphological structures of each subdivision to its function. Begin with the conducting portion of the respiratory tree. This part of the tract consists of the nasal cavities, pharynx, larynx, trachea, and various subdivisions of the bronchial tree. Shown in the center of the field of view is the superior nasal conch from the nasal cavity. Forming the heart or the center of this particular structure, note this little scroll-like region of bone, as was looked at previously. This forms the interior support for the mucous membrane that lies on either side of this particular conch bone that lies within the nasal cavity. So it's forming or lies at the interior of this particular structure that is scroll-like in nature. And this is a cross-section, so you're looking at it sort of head-on as if looking into the nasal cavity. So it's wrapped around in scroll-like fashion. The heart of it has this very thin, paper-thin region of bone that provides the support for this particular structure. So let's find a region that's fairly well intact and examine the details of the superior nasal conch in detail. And the region that we'll look at is an area such as here, as it is fairly well intact. Even with this scanning objective, one can see the supporting structure of bone lying at the tip of the arrow. Now, the interior undersurface of this particular structure is going to be lined by a typical respiratory type of epithelium, that is a ciliated pseudostratified columnar with goblet cells, though it will be much thinner than observed within the trachea. A small bit of connective tissue forming a lamina propria that anchors this particular mucosal surface to the bone, and so what you have really is a mucoperiosteum, where the mucous membrane is attached directly to bone, which is lying here. The covering surface is another very thick mucous membrane type of a structure. In this particular case, again, it's a pseudostratified columnar epithelium, but in this case, it's fairly unique. It's olfactory epithelium. That's a specific type of pseudostratified columnar epithelium. Note the very large area occupied by the lamina propria in this particular case. It will be filled with olfactoria, these unmyelinated nerve bundles, venous sinuses, and you can barely perceive them, epithelial glands extending down, the so-called glands of Bowman, or olfactory glands that are going to supply a serous fluid that's going to cover and the olfactory type of epithelium and aid in dissolving molecules for sensory perception by the olfactory epithelial cells, the bipolar neurons. So let's examine this region in detail as an example of the nasal cavity and olfactory epithelium. Using the intermediate objective, let's examine a section of that superior nasal conch in detail. On its undersurface, one can see, as indicated by the arrow, a ciliated pseudostratified columnar type of epithelium with goblet cells. We'll examine this in detail in just a moment. The lamina propria, the connective tissue thereof, anchoring this mucous membrane, forming a mucoperiosteum directly to bone. This thin scroll-like bone, the conch bone, is shown at the pointer. Typical bone. Coursing beyond the supporting bony structure, one will see numerous vessels, some arterioles that are extremely dilated here. These large structures here are bundles of olfactory nerve fibers, the olfactoria. These structures located here in our epithelium and character are olfactory glands, or the olfactory glands of Bowman, after the individual that described them. These structures here are the venous sinuses in this surrounding lamina propria, so one can observe that the lamina propria underneath the olfactory epithelium is filled with a variety of structures and resulting in the considerable depth that this region achieves. And then finally, we actually get to the olfactory epithelium itself, a very thick pseudostratified columnar type of epithelium, extraordinarily thick type of epithelium, beginning where the tip of the arrow now indicates, and then going, of course, to the luminal surface. So this is typical olfactory epithelium and its supporting structures within the underlying lamina propria. The lamina propria plus epithelium will be anchored and united to the conch bone as indicated by the arrow, as is the respiratory mucous membrane on the opposite side. This particular field simply illustrates the thin ciliated pseudostratified columnar epithelium with goblet cells, that is, respiratory epithelium lining the nasal cavity, in this case on the undersurface of the superior nasal conch. The epithelium extends to about this level. This row of cells here are simply a layer of basal cells. One can make out scattered goblet cells, which for some odd reason the mucin granules are picking up some of the hematoxylin dye and outlining it quite nicely. And one can also make out the ciliated surface from the ciliated cells, and even gets a hint of this little dark interphase at this particular magnification, that is the line of basal bodies that will result in forming the actinium that reside within the interior of the cilia. And of course, down in this particular area, one can see typical bone with an osteocyte residing within its lacunae at this particular location. This particular field represents a region of the olfactory epithelium and should be used to compare to the typical respiratory epithelium, though it was much thinner than one will see in the trachea. The olfactory epithelium consists of three primary cell types. These smaller basal cells, which are sort of germ cells or replacement cells for the other two cell types making up the remainder of this olfactory epithelium. The other two cell types are a sustentacular or supporting cell, and then a typical olfactory bipolar neuron, an actual neuron whose apices will reach the surface, whose cell body lies within the epithelium that isn't demarcated or completely visible. So you have a dendrite that actually extends to the surface, its cell body with the nucleus, and then a axon that will then exit into the lamina propria and join to form the phylo-olfactoria. The sustentacular and the bipolar neurons cannot be visualized independently in this particular section with a routine staining, but can be if more heroic methods were used. These are the basal cells, which form, as I mentioned before, replacement cells for the other two cell types. The lifespan of the bipolar neuron in the olfactory epithelium is between 30 and 60 days. So there is a considerable amount of turnover and replacement of these particular bipolar neurons. One of the reasons for the increase in depth of this particular epithelium is to the progressive differentiation of these bipolar neurons. One might imagine a little bit that these are the dendritic terminals here, but there's no way that we can prove it. If an oblique section is obtained, one can actually trace the processes of these cells to the surface, and an olfactory knob is observed, then one can be fairly comfortable you're dealing with a bipolar neuron, short of specific staining. So this is the olfactory epithelium, and it has this typical characteristic appearance as you see in the field. Nowhere else in the body do we have an epithelium that looks like this very thick pseudostratified columnar, and it is ciliated as well, the olfactory cilia, but they lay sort of parallel or horizontal to the cell surface and aren't readily visible. If one now courses into the thick underlying lamina propria, several structures will come into the field. These are just little clips through the olfactory glands of Bowman, that are going to produce this thin, watery solvent type of secretion that will lubricate the surface of the olfactory epithelium and aids in dissolving molecules so sensory perception can take place. These large structures coming into the field here, and as indicated by the pointer, are some of the venous sinuses that swell up and cause an engorgement of the lamina propria in this area. You can see that they're lined by an endothelium. They're actually filled with coagulated blood. There isn't much to their wall, the endothelium, and a little fine supporting connective tissue. These structures coming into the field here, as indicated by the arrow, are bundles of unmyelinated nerve fibers. These are the processes, the axons, coming from the bipolar neurons, and they form into these large bundles known as the phylo-olfactoria. If we course a little bit further down in the field, you can see the size that some of these phylo-olfactory can obtain. There's a very large one here, another one here, so large in fact that some of these phylo-olfactoria contain their own vascular supply within the substance of the unmyelinated nerve bundles. Another venous sinus is located in this particular location, and these surrounding elements shown here are branching profiles of the olfactory glands. A very light staining serous appearing gland. The basal cell surface is located about here. You can see they have little apical granules that give this darkness to it. A very thin, as one would envision, watery type of secretion to lubricate that surface and dissolve molecules so sensory perception can be achieved through the cilia that are actually lying in this thin film of fluid on the apices of the olfactory epithelial cells. Again, another field just showing another phylo-olfactoria. These, of course, would be Schwann cell nuclei. This field is interesting because it shows some cross sections of these olfactory tubules. Here's the base of the epithelium at the tip of the arrow at that particular location. You can see the nuclei almost show a reverse polarity. They're up near the lumen, which is here, and then you have some small secretory granules giving the gray background on that particular surface. So this is the olfactory epithelium as seen in a routine preparation, and its underlying very thick lamina propria, which houses a variety of structures. The olfactory glands of Bowman is shown here. The venous sinuses and the components, the arteries and capillaries that will be associated with them. The phyloolfactoria, the bundles of axons coming from the bipolar olfactory neurons, and then of course a delicate surrounding and supporting connective tissue. Just a very brief clip or shot of the olfactory epithelium taken at extremely high magnification. The arrow indicates the position of the cilia, but please do remember these are lying horizontal to the surface and don't stand up as do the typical motile respiratory type cilia. So this is the high-powered view of the olfactory epithelium. This particular scanning electron micrograph of the olfactory mucosa on the surface of the olfactory epithelium is courtesy of W. Beipool of Essen, West Germany. He's the one that took this particular photograph. And what it demonstrates three-dimensionally as one views down on the surface of the olfactory epithelium is the olfactory knob or olfactory vesicle as shown here at the arrow. And it also shows the elongated cilia that extend from the olfactory knob or vesicle and lie parallel to the surface of the olfactory epithelium. One can see that this particular vesicle is associated with 7 elongated cilia that are lying in a fluid and are lying in a position parallel to the surface epithelium. The surrounding area underneath the cilia, one sees numerous microvilli projecting out from the surrounding supporting or sustentacular cells of the olfactory epithelium. So this knob represents the sort of the terminal point of the dendrite of these bipolar neurons, and the cilia are modified as such, together with their interior microtubules that are arranged slightly differently, act as the sensory portions of this particular cell. When the molecules are dissolved in the fluid coming from Bowman's membrane, they somehow affect the membranes and the microtubules of these parallel lying cilia, and olfaction is perceived as it is transmitted to the brain via these bipolar neurons. So this is an olfactory knob at the apex of the dendrite of one of the bipolar neurons within olfactory epithelium. This is an immunohistochemical preparation of the olfactory epithelium, an epithelium that was treated with olfactory marker protein, or OMP. This particular protein is specific for the bipolar neurons within the olfactory epithelium. And so using a histochemical technique and developing an antibody to this olfactory marker protein, one can demonstrate the olfactory bipolar neurons. Here's the olfactory knob as shown at the tip of the arrow, this long apical dendrite. The cell body is located at the arrow where the nucleus resides, and then right at the very tip one can see a very fine axon going out of the field. Another is shown here, an olfactory bipolar neuron, and others in the background. Here's one cut a little bit obliquely, and another fairly decent one showing this long apical dendrite. So the olfactory epithelium contains true neurons, these olfactory bipolar neurons, which have an apical dendrite that goes to the surface and ends in the knob, and the axon will leave the epithelium and congregate with others to form the phyla olfactoria. This is a view at, again, very high magnification, showing you the branching tubules of the olfactory glands of Bowman, these olfactory glands that produce this thin, watery secretion. The base of the cells is shown here, and then some tiny granules along their apical surface that we observed earlier, but really couldn't visualize very well. Here you can make out the details of these very tiny granules along the apices of these particular secretory cells. The venous sinus, or the wall of one, a portion of the wall of one is shown here, and even at this point, where the arrow indicates, you can see the gland and its forming duct at this point actually entering into the olfactory epithelium to course to its surface to put its secretion on the surface or release it there. So these are the high-powered view of these rather strange olfactory glands, and there's nothing else that I am aware of, at least, that look quite like them anywhere else. This particular field represents a section of trachea. What characterizes the trachea are the large cartilage plates, or these U-shaped cartilages that form around the exterior wall of the trachea that help maintain its patency due to the extreme pressure changes during inspiration and expiration. So this is a longitudinal cut through the long axis of the trachea. Another cartilaginous ring cut crossways is coming into the field of view and is shown in the center of the field where the arrow now resides. Another cartilage block should then appear in the field. And so there will be several of these large horseshoe-shaped cartilages forming the support for this conducting portion of the trachea. Between cartilaginous blocks is a fibroelastic type of connective tissue. This is to give considerable flexibility to this particularly large airway that lies in the neck, of course, allowing the head to be turned so it can have some degree of flexibility and wouldn't be a rigid structure. The other advantage to having hyaline cartilage, of course, is its lightweight nature, yet is very, very rigid. Here's perhaps a little bit better demonstration of that fibroelastic connective tissue uniting these cartilaginous U-shaped cartilage plates. Now, also shown in the field quite well is epithelium. As one will recall, this is a ciliated pseudostratified columnar epithelium with goblet cells. In this particular case and in this region, one can see an underlying fine connective tissue even at this magnification. It extends from about where the tip of the arrow is to approximately this location. This delicate connective tissue that oftentimes contains immunoactive components is referred to as the lamina propria. Now, the epithelium, this respiratory epithelium, plus the lamina propria constitutes what's known as a mucosa. In this particular case, it would be a respiratory mucosa. Shown on this particular section and not seen in other regions of the trachea on many occasions is some slips of smooth muscle, as indicated by the pointer coursing through this particular field. This is sort of a boundary between the lamina propria, or the connective tissue thereof, and this coarser type of connective tissue in this particular region, which is oftentimes referred to by many as a submucosa in the trachea. It is in the submucosa that the tracheal glands are found. These are compound tubular alveolar glands of a mixed variety, as they contain both serous and mucus type elements. And some of these can be made out even with this scanning view. Serous elements here, some mucus tubules here, and as we course along, one can see these units repeat, and actually this one actually enters into a duct that will course along and then of course empty onto the surface to provide the trachea with additional secretion, in addition to that provided by the goblet cells. Now, the other feature that can be witnessed is if one looks at the exterior surface of the trachea, one finds a loose, scattered connective tissue. It's relatively torn in this particular section, but this is the adventitia. The adventitia contains blood vessels, nerves, as can be seen here. Here's a small nerve, probably an artery, small vein, another artery located there. Small vessels that run along the exterior of the trachea. It is the adventitia, this fine, felty, sort of relatively insignificant type of connective tissue, but yet very tough as it binds it to adjacent structures such as the esophagus or the other tissues within the region of the trachea. So it serves to bind this tube to adjacent structures, and on occasion, despite its histological appearance, can be quite tough. So these are the main features of the trachea. The cartilage, of course, a respiratory epithelium, and this large tube can only be trachea. Once again, the slips of smooth muscle can be seen separating the lamina propria from the submucosa. Please be aware that there are several regions of the trachea where these smooth muscle slips forming this fine layer are not as obvious, very difficult to see, and some authors indeed will remark that it's lamina propria throughout its extent in containing these glands. Others, to create a similarity with the gut, refer to this as the lamina propria as it was described to you, and even if the muscle isn't present, the position of the glands sort of indicate the region of the submucosa. So these are the most important features of the trachea, this large conducting portion of the respiratory system. Increased magnification of one of the tracheal glands. Remember, these are compound tubular alveolar glands, as was stated earlier. One can see sections through portions of the mucus tubules, as well as scattered elements of these light granular serous appearing cells. In this particular case, they're forming demilume type structures. Here, once again, if we look carefully, you can see a mucus tubule and its association with a serous element here, and the same thing is true of this particular unit shown at the top of the field. The central area is one of the ductal forms that would then be coming out towards us. So if we looked at this particular section as moved here, you can see one of these mucus tubules forming the heart, more or less, of this little lobule as outlined by the arrow. Both serous, demilumes here, some cross sections of mucus tubules. Well, anyway, this mucus tubule courses perhaps this way, comes through the field here, and then will eventually empty into this centrally positioned duct, which will eventually course towards and unite with the luminal surface. So these are tracheal glands, mixed glands, that lie in the connective tissue substratum beneath the epithelium. Some authors like to, as I mentioned previously, place these in a submucosa and try to make a similarity with the gastrointestinal tract, but that subdivision is very difficult to see oftentimes in various sections of the trachea. I'm just coursing along that gland that we observed previously, and finally it ends into a duct that's going to conduct materials, secretory materials, to the surface of this particular organ. This particular field represents a cross-section of the trachea. Once again, a respiratory epithelium on a very thick basement membrane is shown at the pointer. The area of underlying connective tissue, if one prefers to call this the submucosal area with tracheal glands, and this felt-like nature connective tissue here being the lamina propria. If one now looks at the entire field and, of course, moves the slide along this field, you can see that in this particular case the cartilage plate has been cut parallel to the ring because it's a cross section, and all the features remain true. It just demonstrates the size of a portion of one of these lightweight cartilaginous rings that serve to keep the airway patent. And these features repeat themselves over and over again. At this particular angle, we can see all the layers: the respiratory epithelium and its basement membrane, sort of a lamina propria area of felt-like of connective tissue, and then a more coarse caliber, if this is the avenue that's chosen, coarser, wider bore connective tissues that are yet open that house the tracheal glands, being the submucosa. And then if we go beyond, in this particular section, the perichondrium, out to here, this is perichondrium here, this type of connective tissue is the remnants of the outerlying adventitia, what that's going to anchor this particular organ to adjacent structures. It'll oftentimes contain small nerve bundles and vessels of various sizes. Now, as one courses towards the back or the posterior aspect of the trachea, one can see a huge band of smooth muscle coming in that clearly delineates at this point a lamina propria from an underlying submucosa with the tracheal glands. So that is true on the posterior aspect, and this is sometimes referred to as the trachealis muscle. And what it functions to do, it appears, is unite the ends of the horseshoe of these horseshoe-shaped cartilages that are in the tracheal wall, keeping it patent, and the open ends of this horseshoe of these tracheal cartilage is united by this huge smooth muscle band known as the trachealis muscle. So this is typical trachea, again characterized by a respiratory epithelium, obviously, and these huge horseshoe-shaped hyaline cartilages. The tracheal wall is seen at a slight increase in magnification, that is with the intermediate power objective, showing you the respiratory epithelium, or the details perhaps a little bit better. Even at this intermediate objective, one can make out the tufts or clumps of the cilia. A few goblet cells can also be made out at this low magnification, as indicated by the pointer, and there will be more hidden in the underlying epithelium. Note once again it is made up, or that is, the epithelium is made up of cells, or what appear to be multiple layers of cells, 2 or 3 layers of nuclei. Please recall that this is a heterogeneous type of epithelium. That is, it's made up of a variety of cell types, and this perhaps accounts for this pseudostratified appearance. There's obviously ciliated cells, goblet cells, some of these small basal cells, as well as other cell types that can't be recognized with this particular preparation. Here, in this particular case, we got a well-developed basement membrane underlying the epithelium, as indicated by the pointer, and then we go into the underlying lamina propria. which is this loose type of connective tissue, and it is subject to, and one will often see, lymphocytes coursing through this particular type of connective tissue. We then go, without much of a boundary, into the tracheal glands and their typical appearance, a mixed compound tubular alveolar form of gland that's providing secretion, additional secretion, in addition to goblet cell secretion to the luminal surface. And then finally into the classic hyaline cartilage plate, moving beyond it, and then getting into the tunica, or the adventitia, surrounding the tracheal wall and uniting it to other structures. You can see there's various caliber of vessels, nerves, and this loose connective but tough connective tissue anchoring membrane. This is typical respiratory epithelium. That is a ciliated, pseudostratified columnar epithelium with goblet cells lining the trachea. As seen in a plastic section now, and stained with hematoxylin and eosin. One gets a better appreciation at this increased magnification with the slightly better preparation of the depth of the epithelium, the multiple layers of nuclei that it presents, though it is a form of simple epithelium, and one can actually visualize the ciliated surface shown at the arrow and begin to appreciate the basal bodies that form the axionemes to these cilia on the apical surface of the cell. These reddish staining looking cells, for some reason, the goblet cell mucin granules have taken on a little bit of the red dye and give that appearance. The other cell type, in addition to the goblet cells, the ciliated cells, are the little basal cells, these sort of replacement cells sitting on the basement membrane. This region, as indicated by the arrow, is the laminar propria, as seen in a plastic section. Perhaps a little more convincing illustration that this surface is indeed ciliated. The cilia are shown at the tip of the arrow, and the basal bodies, though they're not well resolved, they're forming this little dark beaded line, as again indicated by the pointer. So recall that these cilia, these respiratory cilia, the beating cilia within the trachea, are beating towards the pharynx and the oral cavity. So the entire clearance of this bronchial tree is towards the pharynx and oral cavity. This little film of fluid that they're moving is moving in that direction. This particular figure is a scanning electron micrograph taken of the surface lining epithelium of the trachea. So this is what the top of the ciliated pseudostratified columnar epithelium with goblet cells actually looks like. Note that there, as one would expect, tops of non-ciliated cells, some of which will have elaborate development of microvilli, as in this case, but there are numerous cells at the top or at the apex of this very thick epithelium that are not ciliated. Scattered around between these non-ciliated cells are, of course, the ciliated cells, as is shown here. So each one of these tops that have these sea anemone looking type of structures are the cilia. Very good illustration of cilia as seen in the tracheal epithelium. Another cluster of them are shown here. So this particular scanning micrograph is excellent as presenting the three-dimensional features of these cell surfaces, in this particular case illustrating the clumps of cilia on the cell apices of some of the cells, but not all. One should always remember that there are a number of cells within the tracheal lining that reach the top that are not ciliated. Now, a high-powered scanning electron micrograph of the cilia coming off the apices of one of the tracheal lining epithelial cells. So this gives you a pretty good idea of the size of and the overall nature of individual cilia as compared to these small structures shown somewhat in the background, which are the small microvilli coming off the apices of perhaps an adjacent goblet cells or a non-ciliated cell. So this clump of cilia are coming off the apex of a single epithelial cell. Having completed an examination of the materials available for the extra pulmonary conducting portion, examining section of lung, concentrating initially on the conducting portion. What you see in the field of view is a section of lung, alveoli making up the background. So the first way to proceed is to look at the entire section and just see what structures can be observed with the scanning objectives. So we're now looking at a field of lung, and coming into the field, easily visible even with the low power objective, is this large tubular structure that fills the field of view. This is probably a primary bronchus within this lung tissue. Identified at this particular magnification, one can see plates of hyaline cartilage forming its circumference. So you have a layer of plates surrounding the circumference of this particular structure to help maintain its patency. As we will see later, it is going to be lined by a typical respiratory form of epithelium, that is a ciliated pseudostratified columnar epithelium with goblet cells. Also shown quite well is the bronchial smooth muscle layer. And at this particular position, it is going to subdivide the connective tissue component into little areas, little folds. That connective tissue that supports these folds is the lamina propria. You then have this band of bronchial smooth muscle, and then the bronchial glands. In this case, they're very similar to the tracheal glands, but because they're in the bronchi, these bronchial glands are going to be in the submucosa between the plates of hyaline cartilage and that bronchial smooth muscle usually, though you can see some have been pushed out and actually lie down between cartilaginous plates. So these are the characteristic features of one of these primary bronchi, the hyaline cartilage, the typical respiratory epithelium, and those bronchial glands. So this is up primary, one of the major subdivisions in this region of lung. Now there are going to be successive subdivisions from this particular bronchial tree, and it's important to find one of these smaller units if possible and look at the distal or the tertiary, the terminal portion of a interpulmonary bronchus. A tertiary or small division of an interpulmonary bronchus is shown at the tip of the pointer. It's one of the terminal segments, so it's down at the tertiary level just before it becomes a bronchiole. It can be identified by a supporting bit of hyaline cartilage, and when we go down and look at it at lower power, one can still see bronchial glands coming into the supporting wall. The bronchial smooth muscle, of course, is prominent, and then you get a pretty elaborate folding of the mucous membrane, which is probably more simplified at this point, probably a ciliated columnar with a few remaining goblet cells within it. So we're looking down into the lumen as it is cut at this angle. Then I think this particular terminal bronchus went in the direction of the arrow and then split into two regions. So we're getting a pretty good portion of the hyaline cartilage as we cut it tangentially, and one can obviously see the glands associated with this particular airway passage. Lymphoid tissue can also go down to about this level. Now, once one enters into the bronchioles, the hyaline cartilage will disappear. The glands also will disappear usually at this point, as well as any accumulations of normal lymphatic tissue. So this particular field shows the tertiary, or the smallest subdivision of one of these terminal bronchi as they come down and subdivide. Let us now go back in the section and compare it to a primary bronchus, one of the larger subdivisions, and note the difference between these two structures. So we're going from this structure as indicated by the pointer, sort of the end point of the bronchus system, to a structure such as this, which is more representative of how this the intrapulmonary bronchi actually began. So let's examine this one now at increased magnification. This particular field represents a typical large intrapulmonary bronchus, and even though some of the details can't be made out crisply in this rather oblique section, what are the characteristic features of one of these intrapulmonary bronchi, particularly ones of larger sizes? Well, first of all, it is lined by a typical respiratory epithelium, and you can see there are numerous goblet cells within it. The other characteristic feature is that it will have these isolated plates of hyaline cartilage forming its wall, the bulk of its wall, to maintain patency of the airway. So those are the two primary features. But additional features that can be made out and are always present is the bronchial muscle that is now prominent and has made a definite appearance. The felt-like or small amount of connective tissue that supports the overlying epithelium or the lining epithelium. This region here and over here is lamina propria. You now have bronchial glands that are quite prominent, replacing the tracheal glands higher up in the respiratory tree, but function very similarly. You can actually see the duct of one of these compound tubular acinar glands going up and then emptying in onto the surface of this bronchial system. Once again, the beat of the cilia is going to be towards the oropharynx. And so we're simply moving the field now, showing you how these units repeat over and over again. A characteristic feature is the hyaline cartilage plates, a relatively thick, prominent respiratory type of epithelium, and now making its appearance in its well-established bronchial smooth muscle and bronchial glands also within the field. So if we just course around this particular structure, you can see how these various units repeat again and again, forming the overall structure or wall of this particular large conducting airway. Respiratory epithelium, the lamina propria, bronchial smooth muscle, bronchial glands within the connective tissue just to the exterior of this muscle, so they're in the submucosa, and then the supporting plates of hyaline cartilage, which are key in the classification. So as one can see, as we trace around this particular conducting airway, this major one, this major pulmonary bronchus, or a primary one, these structures, these subdivisions, repeat themselves over and over again. And then finally, if we go to outside of this particular structure, you should run into typical alveoli and other elements of the lung as shown here. So you know you're dealing with an intrapulmonary bronchus. The lining respiratory epithelium of the large intrapulmonary bronchus is seen at increased magnification, just to illustrate the nature of this particular respiratory epithelium. The cilia can definitely be made out on the apical surface despite the thickness of the section. Even the little beaded line of the basal bodies is visible on this particular section. Note the numerous goblet cells present in this respiratory epithelium. This is just blood and serous exudate that when this tissue was gathered, when they removed the piece of tissue from the lung, unfortunately it was contaminated by an inflow of blood and fluid. This is simply just to demonstrate quite clearly the ciliated surface and goblet cells. The other feature to note is that notice the different magnitudes or degrees of depth that the respiratory epithelium can assume. If one thinks back to the inferior surface of the nasal conch, it was quite thin, but pseudostratified, ciliated, and contained goblet cells nonetheless. In the trachea, it was of considerable depth due to a mixture of cells. It was quite deep, or thick, even though it's a ciliated pseudostratified columnar epithelium with goblet cells. So that's perhaps the thickest region to see it. And then finally, when we get down to the intrapulmonary bronchus, this primary structure shown in the field, even though it is a ciliated pseudostratified columnar epithelium with goblet cells classified as typical respiratory, it is a little bit thinner than what one observed in the trachea, as can be seen and illustrated in this particular field. So this is the respiratory epithelium of an intrapulmonary bronchus. The supporting lamina propria is here, and of course bronchial smooth muscle cut lengthwise, and then finally to the exterior a portion of a typical bronchial gland. This represents a section through the tertiary bronchus, that smallest subdivision of this dividing conducting portion that still retains its cartilage. So this would be an example of a tertiary intrapulmonary bronchus. Note that the features are still present, but what makes it still in the bronchus component is the retention of the hyaline cartilage plates, which will disappear beyond this particular point. Also shown quite well, if we look at this segment, are retains bronchial glands, which also will disappear as we go into bronchioles. And you can see these glands completely circumscribe this particular tertiary bronchus. Bronchial smooth muscle still retains its prominence. And if we look at this particular epithelium, it now perhaps will be lined by a more simplified form of epithelium, perhaps a ciliated simple columnar with goblet cells. As one goes distally down this conducting portion, the layers become thinner, the epithelium becomes simplified, the cartilage and the glands and any lymphoid tissue associated with the bronchial tree will then disappear before you actually go into a true bronchiole. A portion of that tertiary bronchus wall as seen at increased magnification. showing the lining epithelium when it's observed with a little higher objective, higher powered objective. You can see it's becoming simplified. At this point it looks simple columnar. It retains cilia, so it remains ciliated. There looks like a few scattered goblet cells at this point, but they too, compared to higher in the tree, are becoming less and less numerous. So this simply demonstrates or illustrates quite well how the epithelium's thinning out, becoming a simple columnar form. The cilia are retained at this point, but the goblet cells are much, much less frequent in number. And of course the bronchial muscle retains its prominence and will become a major supporting element of the bronchiole wall. One can see that this is pretty rapidly transitioning into a simple columnar epithelium that is ciliated, and the goblet cells are much, much less numerous than they were in higher subdivisions of the bronchial tree. One can see by careful examination of the epithelium lining this tertiary or distal bronchus, its most distal extent, that the epithelium forms a simple, more of a simple columnar lining epithelium that is still ciliated, so it's simple, pretty much ciliated, with only occasional scattered goblet cells. One is shown at and indicated by the pointer, these gray-looking granules, mucin granules that I've taken up the dye. Another is shown here. So the goblet cells in this distal portion of the bronchus are much less numerous, and this is how it should be if you think about it. The mucus blanket is getting less and less thick. You want it to decrease and disappear at this point, and you have a ciliary draft or a ciliary beat going on distal to it. Returning now to the scanning powered objective, we looked at the tertiary bronchus, the terminal part of that conducting portion of the respiratory tree that retains its cartilages, and one can see this terminal bronchus here once again at low magnification, and then it's going to split and go in either direction. And what will happen as this transitions now into a true bronchiole is that the cartilages will disappear, the glands will disappear, lymphoid tissue will disappear, and one will be visualizing a tube that shows that folded, scalloped interior surface, and the only element of the supporting wall, or the primary element I should say, is going to be the bronchial smooth muscle. So as we're looking around this particular field, we can see a tubule that's been cut parallel to its long axis as it snakes through this area and then goes in this direction and splits once again. This is sort of a tangential section through a bronchiole. Another typical cross-section of a bronchiole is shown at the tip of the pointer. Another bronchiole is shown here and indicated by the pointer. So they are a magnitude less than that tertiary bronchus that showed the last little portion of cartilage. And in comparison, if we look at a primary bronchus, one of the major subdivisions of that conducting portion of the respiratory tree, this was the section of an intrapulmonary bronchus examined earlier, a primary. A very large structure with that cartilaginous support, And once we compare it now to that important structure, the bronchiole. So use the scanning objective to find such bronchioles and then examine each of these at increased magnification.